Assalamu alaikum wa rahmatullahi wa barakatuh. Kwaniriza lero ku program yaffe obulamu nange Mariam Businge wano ku Salam TV olutimbe gagadde. Njagala kukulisaayo wena avudde ku mulimu abavudde ku ssomero bannaye bahaji ate mukulike ye Makka bannaye tulinze invitation wa shukuru ate mututuukirire wano ku Salaamu tujja kubakyalira insha Allah munaba mutuyise that is mukulikeyo bahaji ne bahajati abagenda mu hijja ate nammwe mwenna abava gye mube mukulikeyo. Njagala kugamba tukyali mu NBS at 15 tewerabira beera steady beera better togaba pini yo don't share your pin ne wabeera mukyalawo ne wabeera mukyala ati love olusegera ne baziba amaaso ne mugaba pini namba zammwe n'abaana ne bagimanya naye mwana ayinza okuba nga azanya kumbe waliwo agirabye ne bakubba so be steady ate mwewale kozesa wifi za public bannaye naddala ng'okola online transactions bw'oba okola online transactions ezo ojja kwesanga nti mbu data wo yenna can be hacked naddala ng'oli ku wifi ya public so watch out mugule data beera steady beera better. Today we are going to do a show in English. This is a warning to everybody. Show leero egenda kubeera mu luzungu gwe nina leero munaye nakyaziza muzungu avudde Cambridge Oluganda lwe his Luganda is not Lugandaling. So before we go any further, let him say hello to you and then we see what he has for us. Good evening.
Good evening, madam.
What's your name?
I'm Mugarura David.
Oh,
yeah.
A doctor?
Yeah, I'm a dentist.
What are the ranks of dentists?
Dentists?
Like we have the other doctors, we have the medical doctors, we have the gynecologists, we have the pediatricians. What are the ranks of the dentists?
Yeah, being a dentist is a general word, but in dentistry you find you have technicians, you find you have orthodontics. Basically they're also dealing in technician, but further ahead. Then we have dental surgeons, then we have PhDs. Yeah, those are different ranks, but they are all dentists. Basically they're doing the same role. My
dentist is called Sechibamu Alex. He works with Medivine Hospital, Salama Road. Kuchikuba ekisinga okubeera ekibi mu Kampala Salama Road. It's called Medivine Hospital. Alex kutumiddeko nnyo. So today we're going to talk about a very, very sensitive topic. It's a bit sensitive in the sense that our mouth, our teeth are a very, very important key aspect when it comes to our general body appearance. Trust me, you wouldn't want to sit near somebody who has a bad smell or a bad odor, especially coming from the mouth. So today we're going to discuss oral hygiene. He's going to tell us what is oral hygiene.
Okay, thank you so much, madam. The simplest definition about oral hygiene, it's the daily practice of maintaining, of cleaning someone's mouth and making it free from the bacteria, disease, and other harmful effects that you would get in your mouth.
Okay.
Yeah.
How often am I supposed to clean my mouth? It's
really advisable that every after meal.
What about us who work? For example, I've spent the whole day at work. I didn't carry my toothbrush. And I had lunch, I had a snack, I ate something. How am I supposed to do that?
Yeah, it's kind of crucial, but something dealing with life, it's something acceptable that you should also follow it. At least you can move with flossers for flossing after eating. After eating, you can try to cleanse your mouth using water to remove those food particles that may give a room for the generation or reproduction of germs in your mouth.
Okay. How best can I keep my mouth fresh and clean?
Fresh and clean. Regular brushing is very important.
That is one.
That's one. Another one, the one I've just talked about, cleansing your mouth using water even after meal.
Okay.
Another one, you should avoid sugary foods. avoiding sugary foods.
What about us who like sweets? Some of us who like snacking, chocolate. I'm not a fan of chocolate, by the way. That is the funny part. They say women like chocolate. I don't like chocolate.
You really help. They are also important because they have the nutritional advantage in your body. But you know, when they say too much of anything is always bad. Too much of anything is always bad. When you take it, basically, when you want to maintain your oral hygiene, you avoid this middle snacking. You have eaten lunch, after 1 hour you take a snack. You forget about cleaning. At least when you have your lunch, take a snack and clean your mouth. Then evening, have a snack and take your mouth, rather than and clean your mouth.
Okay.
Yeah. Okay. The middle snacking has always caused that effect of people forgetting, taking it like I have not eaten.
It seems normal. You just eat and
it's
continue with your work.
Yeah, continue with your work, but you are leading to the accumulation of the plaque or the bacteria in your mouth that may lead into cavities, destroying of your crowns, leading to very many effects that we are going to go through.
Okay. So let's continue. Washing mouth, rinsing, washing. Okay.
Then also chewing.
Avoid or do?
You should chew. You should avoid chew gums containing a certain substance called, let me see it here. There are those specific chewing gums. It's called the thymine.
Cement.
Yeah, it's a chewing gum itself. It's sugar-free. First of all, it doesn't contain sugars.
Okay.
I have told you the effects of sugars into your mouth. They are basically providing a room or better environment for the developing of plaque or bacteria that may chew you, or they may damage your crown.
Okay.
The crown is that upper part of the teeth that we see. The teeth has two parts. It has gotten the roots and the crown.
Okay.
So as the plaque accumulate on the crown here, that's why I brought this model. This is the crown.
Okay.
Then the roots are inside.
You show him that side.
This is the crown. The crown is the upper part, the tear that we see. This white thing that we are always seeing is the one we brush, the one we use to masticate or to chew. As the plaque or bacteria accumulate here, it chews this, damages the crown, causing cavities. When it causes cavities, then the bacteria goes inside into the pulp or jemuite miswa. After damaging the pulp, that's why we get bacteria, or rather we get the blood infection. The infection ingira munda miswa.
That's when you feel like I have a hole in my tooth.
The hole, actually you can even get the cavity even before and you don't feel the pain. But as the bacteria goes, the hardest part, which the enamel has been damaged, the bacteria goes into the pulps and damages further, deeper, as we are going to explain.
Okay. You talked about brushing. No, there are some people sometimes who brush and you feel like you want to throw up. Or some people practically throw up. What causes that?
Throwing up, it's caused up by different things. First and foremost, the techniques of brushing.
Okay.
Yeah, techniques of brushing. You might go further.
Beyond the tongue?
Beyond, yeah. When you talk about the anatomy of the oral cavity, it has different sensitivities that even if I explain here, people may not understand. But when you are brushing, you should know where you are going to stop. This is the person's oral cavity. This is where in the mouth, you have the molars, the premolars, the anteriors. So why you shouldn't exceed this line when you're brushing.
Somewhere in the middle here, we have a tongue.
Yeah, where you have your tongue. When you exceed here, of course, you feel that effect of throwing up. You end up vomiting.
Okay.
Mostly it's done when you are brushing your tongue.
Yes.
Yeah. So you shouldn't exceed at a certain point.
Okay. When we were still young, we were told that you breathe up and down, up and down. Does that technique still work?
It can work, but it's kind of dangerous at a certain point because this is your gum. This is how the gum is. You are brushing. Sometimes you may find you are weakening the gum lining here.
When you are doing this?
Yes, when you're doing this. It's better you do the smooth circular form. Smooth circular form. That you may not affect the gingiva or what they call, the layman's language called the gum.
Bachita chibuno.
Yeah.
So you have to do circular. Slow circular. Okay. Look at that. Febatu gamba. Up and down, up and down. Now we are getting another technique of circular. Does the brush I use matter? A toothbrush, the one I use, because our viewers were sorry we couldn't bring toothbrushes on set because toothbrushes are branded, and we wouldn't want to antagonize people's brands or get anybody's copyright at stake here. But here is a situation whereby we have different toothbrushes. Does the toothbrush I use matter so much? Yeah,
sometimes it matters.
How is it supposed to be? Because one thing I know, we have infant toothbrushes and then we have the adult toothbrushes. At least I can differentiate that.
Do you know, have you ever noticed the infant toothbrushes? They have those soft bristles.
Yes.
Meaning their gums or the gingivas are still soft.
Soft, yes.
So if you get a young child with a soft gingiva or soft gum and you use that hard brush, basically you're going to affect the gingiva of the child. Even you yourself, it should be very important if you use a soft Bristol brush to avoid that excess abrasion on your gum.
Okay, thank you so much. Our dear viewers, we are discussing oral hygiene, and this has to do, it goes beyond brushing your teeth. It has to do with the entire mouth. So it depends on how you take care of your mouth. You know, sometimes you can really feel like, you even feel yourself that you have a bad breath. You can feel it yourself, especially when you're waking up in the morning, especially when you've taken long, when you're so quiet. You know, when you're fasting, you can feel like as if there's some breath which is coming out of you. So today we are discussing the best way you can do to check your oral hygiene. What are the consequences of not taking care of your oral hygiene? Or what are the consequences of poor oral hygiene?
Thank you so much, Madam. The consequences or the sequelae of poor oral hygiene: one, you may get a heart disease.
How is it related now? The heart is here. Oral hygiene and the heart. How are they connected?
Basically, you need to know that when you get maybe like the gum inflammation, gingiva or the gum, there is a bacteria. There is a bacteria that will affect your gum. And remember, gum your name is one. It affects the gum which has the veins. The bacteria enters the veins, causing blood poisoning or sepsemia.
Okay.
Or when it goes inside here, of course the blood flows back to the body.
Because of the circulation,
yes,
which
the
is
blood circulation,
in the
the normal blood circulation that you know. As the main organ for the blood circulation, it is the heart. Reaching into the heart has valves. The infection will stick onto the valves, causing them to swell. You get what they call endocarditis.
Okay.
And as the valves swell, they may either be weak to stop the backflow of the blood, or they may even block the blood from pumping from atriums, ventricles, or back to the way the blood circulation, the way it goes from the atriums to the ventricles, then from this chamber of the heart back to the lungs, and from this chamber of the heart back to the body. So as long as you get a blood infection, it will end up affecting your blood, which has come from your teeth. That's how it affects the heart. Then it can also affect your respiratory system.
How? The reason I'm
same
really
thing.
Connecting the two.
Yes.
All the mouth from the mouth to the heart, now to the respiratory system.
Yes.
I know one thing, the respiratory system is somehow connected to the mouth around here, the esophagus. So how is it related to the oral cavity?
It's all coming from the blood poisoning of the bacteria from the mouth. When your blood has been poisoned, remember still for gaseous exchange to take place, the deoxygenated blood has to go to the lungs. From the lungs, that's where you get the bronchioles, and they are affected by the blood infection containing the bacteria from your mouth.
Okay, there we have now the ENT.
Now the lung is also affected.
The lungs.
From your mouth. Yeah.
Okay. What else?
Then it can also cause periodontal diseases. Periodontal diseases, there are these wounds, like you're brushing, you see the blood is coming out of your mouth. You're blushing, blood is coming out of your mouth. Then it can also cause hysteresis. Or
what is that? What is hysteresis?
In layman's language, it's called the bad smell.
That is the bad odor which comes from the mouth.
Bad odor from your mouth.
Yeah,
So when you don't maintain your hygiene for the oral cavity, you develop hysteresis. Then it can also, there's what they call sensitivity. You're biting something, but the crown has already been chewed up or has been affected by the bacteria. You'll be having that sensitivity, like you cannot eat well, that resulting into the insufficient mastication or chewing of your food, which might also result in the complication in your digestive system. And what has caused the poor chewing, it's an effect of your poor oral hygiene. Yeah, there are very many things that you can get from poor oral hygiene.
Mention them, we need them. People need to know what is really the consequence, because trust me, I love my oral thingy. There's a lot we do with our mouth. We do eat. We do a lot of things with our mouth.
Then you can also get a poor taste. You know, your tongue consists of the taste buds. You have not been cleaning your tongue properly. The taste buds have been covered up by the food particles. Surely you will not taste your food very well.
I last heard about that test when we were during in the COVID period, when people used to lose taste. Okay.
That was the infection of the COVID virus. It's specifically it was affecting the salivary glands. Then when there's no salivary gland, meaning you do not have the automatic cleaning of your salivary glands have not been able to secrete enough saliva. You do not get an automatic cleansing of your mouth. The taste buds are covered up, and you lose your taste most of the times.
Okay. So what else do we have to see in case we don't manage our oral hygiene?
And it also causes a discomfort. You know, those people with hysteresis, even themselves, they feel it. I'm very sure at one point.
You mean you feel yourself that you have a bad whatever, you bad, and you don't care?
Sometimes I think it's a sign of not caring, and sometimes people they don't know. They may think that some people think it's allergy. They always resort to that, and you know, allergy.
Allergy yokunyakamo.
Okay, people always find the reasons why they are doing so, but in actual sense, it's kind of a sign of carelessness or not knowing. But it's high time they should know.
Okay, thank you so much. And our dear viewers, we are discussing oral hygiene, and we are looking at the consequences of you not taking care of your oral hygiene. You know, our mouth has a lot. You know, we have, for example, our dear mothers who are at home. You kiss your baby. Yeah, there are those who have pets at home. You know, it is a bit discouraging. That's why I usually say, when I stop kissing our babies, next time I have a baby, please, even if you're my friend, don't kiss my baby, because it's really bad. I don't know where you've been. Restrict your mouth to yourself so that you avoid spreading those funny infections which can be. And what other infections can a mouth get? Because due to other maybe external factors or internal factors, which are related to oral hygiene of the mouth, apart from what we've mentioned?
Okay. Sometimes we misuse our body parts.
Tell me about that.
It's kind of vulgar, but we should know that the mouth is for eating.
Okay.
Basically
Leave
that.
it at that.
Yes, we can leave it at that level.
Yes.
Otherwise, you can get oral candida, which may result
But
in oral cancer.
if I did brush after doing whatever I did, can it still go further?
Yeah, most of our, some of our body parts are more acidic. You know, God created us. God is a very good scientist. Created a specific part for a specific reason. He created your mouth for eating. So if you go further to overwork on your mouth, you are overloading it. Some other parts could be more acidic, resulting into burning of your oral tissues.
Please use your mouth for eating.
Yeah.
Just I'm being kind.
Use your mouth for eating, not other things.
I'm being kind here, honestly speaking. We are not going to talk about what you people use your mouth for. But here is a situation where we are saying use your mouth for eating. And use the other body parts for doing what you're supposed to do.
Give honestly. What belongs to Caesar?
No, who is Caesar here? Who is Caesar here, honestly? Who is Caesar? Maybe people are just experiment. You know, you human beings are good at experimenting. That's why God gave up on some things, really. But honestly speaking, I don't think. How do you treat oral candida?
Of course, you try to fight the bacterial infection because it's always an infection. It may also result into viral infection. So when you are treating it, you always use salty water, because salty water also helps in removing the fluids into inflamed tissues of the oral cavity.
What about warts? There are some people who have ubusundo or kumemwa. You know how, I don't know how, I don't want to be a deep thinker. You know, I'm an overthinker myself, natural. I'm an overthinker. But I don't want to think the worst. But there are some people who from nowhere, the mouth gets sores. Maybe they don't explain to us what happens. How best can somebody clean? For example, if I get an infection in my mouth, how do I clean up? How do I keep it clean?
Okay. One, you should ensure regular brushing. That's one.
When I already have wounds in the mouth?
Yes, you will have it, but what if you have the wounds in the mouth and you let the accumulation of more food particles? That means the wound will get worsened. Then another thing, as a first aid, that you should give yourself warm water, warm salty water. That salty water, it will help you to kill the bacteria, to reduce on the bacteria accumulation on those wounds in your oral cavity. Then another thing, you should avoid, you should improve on your nutrition. Most of the times, we have like you find your immunity is low due to your poor nutrition. Like you should improve on nutrition, like eat more foods containing vitamin C.
We are going to discuss that extensively in our next segment of this very show about nutrition. But I have a question. We've talked about diseases, tooth decay, bad breath. We have talked. The other ones are a bit botanical, and I can't go in too deep into them because these people here have very complicated language, and I wouldn't want my viewers to get confused about this. How many times am I supposed to brush during the day? Because we missed that out. You just told us brush.
At least make it morning, afternoon, and evening. Because I'm very sure in the morning you take breakfast. Afternoon you have taken lunch. Evening you must have taken supper or dinner, something like that. But ensure that after eating, you
had mentioned that.
Yeah.
Does you know, these days what matters most? We are having a lot of products on the market. We are having the natural ones. We are having the minty ones. We are having the medicated ones. There's a one they call what? There's a certain brand which says what? Does the toothpaste I use matter here?
Yeah, it matters, because, but I'm very sure that every brand that goes on marketing, like here in Uganda, we have National Bureau of Standards. They check the quality.
I'm not so sure about that. I'm not so sure about that, but I will check with the Halal Bureau maybe, because for us we usually go for halal. So I don't know whether it is halal or not, but anyway, we're going to have a check about that. Our dear viewers, we're going to go for a short commercial break, and when we come back, we're going to discuss the management of diseases or infections which are related to poor hygiene in relation to this very topic. Stay tuned to Salam TV. Let's go for a commercial break.